PEPFAR, saving lives, investing in people. PEPFAR, partnering for an AIDS-free generation.
Since 2004, PEPFAR has invested $4.2 billion in the prevention and treatment of HIV/AIDS in South Africa, partnering with business, government, and society in response to the pandemic.
It was terrible, and it was really heartbreaking to witness. We could give them preventative help, but we knew the answer was treatment, but there was no treatment available. And it was such a blessing when PEPFAR came along with the program. It was, you know, lives were saved. And before that, people were dying. They were leaving young children, orphans. It was like a miracle, you know, to witness it all.
PEPFAR put resources on the table, finally, that were at a scale that matched this gargantuan problem and disease that was out there.
If we hadn't intervened when we did, I certainly know that the children of this country would be in a far worse place than they are. We would have even more orphans than we currently have. We would have even more infected children.
It's been the life raft or the life jacket thrown out to a population that was rapidly drowning in AIDS. And we couldn't save everybody, but at least we've saved a lot more than if we'd not had that funding.
People are alive, and you can go and ask them out there in the communities, what has it done for you? You can say, I'm here, I'm alive today because of PEPFAR, because of antiretrovirals.
Over the years, obviously, funding has been reduced, and the ultimate aim is to build programs that can transition to government. So government is already starting to subsidize a lot of the services that we offer.
PEPFAR is essentially about life. It's about giving life back to people. It's about restoring people's dignity. And it's about helping people to lead the lives that they should lead if there wasn't an HIV epidemic.
So it's a very profound impact that PEPFAR has had on the delivery of HIV and TB services throughout all of South Africa.
Despite that earlier delay, when we didn't do what we should have, over the past 5 or 6 years has been absolutely phenomenal. We have the largest ARV program in the world.
The PEPFAR billions have made an astonishing and important difference in this whole epidemic, in saving lives and changing people's lives and restoring communities.
PEPFAR has allowed us to dream about a better healthcare system. I mean, it's allowed me to do the creative stuff that I think I wouldn't have been able to do otherwise. I think it's allowed us to fiddle with new models. It's allowed us to really go large and to be ambitious.
Thank you for the PEPFAR people, what they have done, because they have really touched a lot of lives, and most of the people, they are healthy and they are able to look, and at least we can see the progress.
I think PEPFAR brought a necessary light by listening to the voices of the people, by seeing what the problems of the country were.
It is certainly with great thanks and pride that we, have operated and with PEPFAR funding.
The key success there is the fact that PEPFAR was prepared to partner with us. I think most importantly was the fact that we could ensure sustainability. So when you say assistance, when you need support, PEPFAR would be there, either with the funds that we required to produce something, either with the technical support that we needed to solve a problem, whether we needed to put in a nurse somewhere or a doctor somewhere. PEPFAR has just always been the partner through the story of HIV.
I don't think we'll have done it without the help of our development partners, and PEPFAR, of course, amongst them, be in the forefront.
Thank you for PEPFAR. It saved lives, made a difference, and whenever I can, I like to thank the American people for the contribution that they made to my part of the world here. One can't put a price or a cost to that.
The fact that it's a presidential project, it shows that there is interest in Africa succeeding, not just South Africa, because PEPFAR is global. But I think for Africa, it has been a best friend.
Having worked a long time fighting AIDS, I've always looked for what are the interventions that have made the big change? What are the things that have made the difference, that have converted us from despair to hope, have brought life from death? The single biggest intervention in my experience that made the biggest difference was PEPFAR.
Working as part of PEPFAR, we were able to reach President Obama's ambitious stated goal of treating more than 6 million people, providing more than 4.7 million circumcisions, and giving 1.5 million women treatment to prevent mother-to-child transmission of HIV. That means that last year, somewhere in the world, the 1 millionth baby was born who's not HIV positive because of PEPFAR. It's a fantastic legacy.
PEPFAR is nothing short of a miracle. It's been incredible to travel in this country from Mpumalanga right through the Cape, and in those programs I see women who were infected, who thought that there would be no way to sustain their family, who are now sustaining communities because of the fact that they're on ARVs. I'm excited by the promise of tomorrow. I'm excited that we're moving closer and closer to an AIDS-free generation here.
South Africa has led in the pandemic long before PEPFAR was established. The activism in South Africa has been very powerful and important on the continent. I think the financial contribution is important because it signals to the rest of the continent that there really has to be that partnership between the Global Fund, the host country, and PEPFAR in order to be successful.
Since 2012, PEPFAR funding has slowly decreased, allowing for increased investment by the South African government. Commitment by the South African government has increased steadily and is projected to reach $1.9 billion by 2017.
PEPFAR, partnering for an AIDS-free generation.